Hola a todos y todas. Dependiendo del lugar en el que se encuentren, muy buenos días, muy
Hello,
buenas
good morning,
tardes o muy buenas noches. Mi nombre es
everyone,
Rodrigo
depending on
Zavala.
where you are.
Trabajo para la Comisión Interamericana para el Control del Abuso de Drogas, ICAD,
One
de
second.
la Organización de los Estados Americanos, OEA. La CICAD es el órgano consultivo y asesor de la OEA sobre el tema de drogas. Y además,
I am an advisor
CICAD
for
es el centro de
the drug
coordinación regional del Control
consultancy, and
Internacional de
CICAD
Universidades
is
para
the
la
central
Prevención de
control of
Delitos de Drogas,
universities,
ICUDDR, para Latinoamérica y el
or
Caribe. En
ICUDDR.
esta oportunidad, me complace darles la bienvenida a este panel titulado Adaptando la ciencia de las adicciones a las realidades virtuales y lecciones aprendidas en la formación en línea durante la pandemia, y en la cual la Escuela contra la Drogadicción, SD, de Colombia, y la Universidad Central de Chile compartirán su trabajo en relación a la prevención, la apropiación social del conocimiento y el uso de las tecnologías de
As
información y
regards the
comunicación digital.
prevention and the use of technologies
Muchas
in the
gracias a
prevention,
nuestros panelistas de
thank
hoy,
you very
a
much to
quienes
our
les doy
panelists
nuestra
today,
bienvenida y a
whom
quienes
I
paso a
will welcome
presentar
today and
muy
who I
brevemente.
would like to introduce
Primero nos
briefly.
acompaña el licenciado
First of
Fabio
all, I would
Villa,
like to
sociólogo egresado de
introduce
la
Fabio
Universidad de
Villa,
Antioquia,
sociologist from the
doctorando en
University of
psicología y
Antioquia,
sociología jurídica en la
uh,
Universidad
who's
Externado
studying a
de
doctor's degree
Colombia,
in the University of
actual
Colombia
director
in
general de la
psychology,
Escuela
and he
contra la
has
Drogadicción de la
the
Gobernación de Antioquia.
position of
La
general
licenciada Ana
director
María Rivera,
of
psicóloga
different
del
associations
Instituto
on
Farmacodependencia de la Universidad Luisa
drug
Negó.
abuse. We also have a
Actualmente es
specialist
psicóloga de la
in
Escuela contra la
pharmaco and in drug
Drogadicción.
dependency, and
La
she is also a
doctora Natalia
psychologist
Galliano,
specializing in
antropóloga con
addiction. And
magíster en
Natalia
antropología
Galliano, who is
social
an
y doctora en
anthropologist with a
antropología
master's degree in
de la
social anthropology,
CIESAS,
doctor in anthropology by
DF,
CSS
y se encarga
in
actual de antropóloga
Mexico
de la
City,
Escuela contra la
and she's an
Drogadicción.
anthropologist at the
Finalmente nos
School
acompaña el
Against
magíster
Drug
Rodrigo
Abuse.
Goycolea
And we also
Martinic,
have
terapeuta
Master
ocupacional de la
Rodrigo
Universidad
Goycolea
de Playa
Martinic
Ancha, Ciencias
from
de
the
la Salud y
University
la Educación,
Playa
Valparaíso,
Ancha,
Chile, magíster en
the
drogodependencia de
Institution
la
of
Universidad de Barcelona,
Sci-
España,
um, Sciences,
estudiante de
and also he
doctorado en
holds a
salud
master's degree
mental
from the University of
comunitaria de la
Barcelona, and he's a
Universidad de
doctor's.
Lanús,
He
Argentina,
has a doctor's
y
degree from the
director
University
académico del
of La
Programa de
Luz in
Drogas
Argentina, and
Psicosociales
also he's
para la
an
Salud de la
academic director
Universidad
of
Central
the
de Chile.
Central University
El
of
tiempo
Chile.
asignado a este panel es de
And
una hora,
the
por
time
lo
we
que
have
cada uno de los
assigned to
panelistas
this panel
aproximadamente 10 minutos para su presentación.
is limited, so each one of
Dejaremos
the
espacio al final
presenters will
y
have
los
10
panelistas
minutes, and at
podrán
the end, if we
contestar
have
algunas de las
time, the
preguntas que les puedo
presenters will
colocar en el chat.
answer to the
Me
questions that
interesaría
I will
saber a los
kindly ask
panelistas
you
cuando
to
tengan
enter
listos
into the
este
chat,
cierre de filas. Y de nuevo les agradezco
and
su
we will let
participación
know
en este
each one
panel.
of the participants
Iniciamos
as
el
soon
panel
as
con
their
el
time is
licenciado
over. So we
Fabio
will
Villa.
start the panel with
Licenciado Villa,
Mr.
usted tiene la palabra.
Fabio uh, Viña, and I will pass him the floor. Thank you very much. Good morning, ladies and gentlemen. Thank you very much, and my special thanks to ICUDDR, SICAD, and Alfonso, who has been our sponsor in this project. It is a very important day in Colombia. We have a national day, it's the Independence Day in Colombia, and we are here because we consider this to be a very important occasion to share with you what the School Against Drug Addiction is in Antioquia, which is the only school of this type in Colombia. This school is a public institution that emerged from an ordinance by the Departmental Assembly of Antioquia, and the school emerged out of the need of carrying out research, studies, and also developing training in order to accompany the territorial entities in order to promote and protect the health of people in the Department of Antioquia, and also to promote research and studies that could be of help to the Colombian population. And we are dealing with the problems of the drug consumption and also different vulnerable parts of the population, just children, teenagers in the Department of Antioquia. So we have three lines of work. The first one is a line of research, innovation, and social management of consumption. The second one is a line of social appropriation of knowledge. And the third one, technical support and articulation and follow-up across the public and private institutions that attend to and prevent drug abuse in the department of Antioquia. So we are in a stage of positioning this entity, which is dedicated to knowledge. That is to say, we had always institutions dedicated to education, and knowledge was always an activity or a task for universities. So our institution is designed to be in collaboration with research centers, universities, and we started with 3 interventions. The first one was a research in damage reduction in drug abuse, also in different models of consumption, and research on methodological design for restorative justice. And the design focused on prevention, attention to, and damage reduction to territorial entities working with a specific case in order to start this project. And we also have a task for innovating that we have a really ambitious one, actually, which is establishing a school against drug addiction, which is 25,000 square meter long, which has to be expanded to an area of 70,000 square meters. And we would like to also create a museum focused on psychoactive substances in the city. We have also held different virtual encounters with the whole academia, and we created a network with the universities and all the institutions who are committed to working on this issue. And we also had a public tender, and we produced as well a series of articles, and also our book, our first scientific book written with the support of the Ministry of Science of Colombia in terms of prevention and attention to addictions. This has a QR code which we can share with you, and we have 21 scientific research articles on prevention, attention, context, the social context, and above all, topics related to drugs and psychoactive substances. Also, we have entertained different international conversations, forums, events, and so on. On line number 2 of appropriation of knowledge, we carried out a diploma course with 99 out of 125 municipalities of Antioquia, and we also carried out a series of webinars with more than 600 people, conversations, trainings, and regional encounters. And on line 3, which is technical support, articulation, and follow-up, we have been working with the articulation with other institutions, both in terms of prevention and also in attention. We have created a network of institutions which are both private and public for prevention, and we have created different attention approaches. We are generating knowledge to all these institutions in order for them to improve attention. We have established different alliances and partnerships with a series of institutions, both government and non-government organizations, in order to provide support to institutions in order to fight drug addiction. We also have different cross-cutting axes, for instance, the creation of Antioquia Notice in order to detect, assess risks, and generate alerts on new substances. In Colombia, there are more than 41 new substances that we have detected, and of course that is worrisome. The civil authorities, not only the police, we actually have nothing to do with the actions of the police, but there are other actions And we generate information in order to understand from the public health point of view what is happening, and for the other institutions to know what kind of substances there are, what kind of substances are coming to the market, and what is important to focus on. We have also created a line of research with Innovation and Development Institution from Medellin, which is called OPAM, and which focuses on medicinal cannabis. And we have to consider that Antioquia has a geographical location which is beneficial, with very favorable conditions for the cultivation of medicinal cannabis. So we have dealt with the issue from the scientific perspective. Another crossing issue is the creation of an epidemiologic monitoring system for psychoactive substances that includes a protocol with different research topics, the training of municipal teams, the pilot, everything. And from now all the way through December, we will have established this surveillance system, and based on that surveillance system for epidemiological issue, we will be able to continuously monitor the department and also provide and generate knowledge on the consumption of substances. We also talk about different challenges, for instance, the adaptation of the school to a new modality of work, which is the virtual one. So we have worked both virtually and also face-to-face. We take turns for that. We take turns to work from home, to work face-to-face, and we have incorporated all the technologies necessary for carrying out this. We have also had a series of virtual encounters. We have found the best tools in order to do so, and we have also found as a challenge the application and the use of different technologies. We have incorporated new ways of establishing relationships for new partnerships and agreements, and the support of ICUDDR and CICAD in order to establish international relations has been of great importance in order to understand this topic in Colombia. Also, we have seen ways to adapt the environment in order to have presence beyond Antioquia by means of the virtual networks. And we have also tried to adjust our scope in order to work best. And I have to close by saying that this school is a school that is working with a very small team. We are only 25 people who are linked to the school. We have other 10 people who are mostly very high-level professionals. But the most important thing is that we have the clear conviction that we can carry out work with local authorities, with public servants, with different institutions in order to prevent and to, based on knowledge, on scientific knowledge, the inadequate use of psychoactive substances, better knowledge in order to provide better care. Thank you very much. Mr. Rubí, thank you very much for your presentation and for your ability to synthesize the work of the school. We know that there is a lot more to present. Of course, this has been just an abstract of what you have been doing, and it's very impressive, and this only shows the great scope of the school. I have a couple of comments, especially one from Kimberly, who says she's learning a lot from your presentation. And well, this is actually the idea of this panel, to share information. And well, now we have Ana Maria Rumbert, who is a psychologist specialist in drug dependency, and she also teaches in a university. Now she has the floor. Good morning, ladies and gentlemen. Please confirm whether you can see my screen or not. We confirm we see your screen, and If you can speak closer to the microphone, that would be great. Well, thank you very much. So, based on the presentation of the director of the school, well, I'm going to talk to you about a very successful and positive experience we had last year, where we complete a diploma course, and this was provided and offered by very specific people in the Department of Antioquia. And we also tried to include people as participants or students and allow them how to appropriate knowledge and also understand the use of substances and provide them with tools that they can use. And also we talked about specific strategies. That diploma course was about developing abilities for the management of drug abuse, and we could identify 142 public servants of the sub-regions of Antioquia. We strengthened the response capacity in order to address drug abuse. We had a participation of 99 municipalities out of 125 of the department. The attendance was of 80%, and the duration was 120 hours. We could articulate together with the municipalities. We could talk to mayors, secretaries, in order to have space for this, because some of them were public servants, and of course their schedules were tight. So this partnership allowed to create the space for the public servants to participate and give continuity to the process that we had started. The experience I had was very positive, and this was not only about training on addictions, but also we had a very interesting experience in terms of research, where they had different spaces and where they developed different research techniques. They could also carry out some territorial readings in which they could look at each one of the municipalities and expose the issue and the context of each one of the municipalities. So this was a very positive space, because in addition to being able to become trained, they also had real-time opportunities in order to talk about their doubts, their questions, their concerns, and by means of dialogue and participation, we could also share the different experiences we found in different contexts. Now you can see a very positive image. This is the graduation moment. Of course, this had to be done in a virtual way, but we could listen to the students and listen to each one of the experiences they had, where they talked about how positive this was in spite of the situation we were living with the pandemic. And they were thankful for having been able to participate in these virtual workshops and also to focus on the populations they are responsible for, and they were seeing very clear results. This course was carried out in 5 modules. Each one of the modules responded to a very specific topic where we endeavored to expand or to delve into the drug abuse topic. And across the course, which lasted approximately 6 months, the students looked for different alternatives for reading these different territories, and we found that each one of the territories has a very specific context. So based on this, we came up with strategies and knowledge strategies in order to support each one of the territories. So this was very positive. We did it in hand in hand with the University of Antioquia, which is a very renowned university in Colombia, and they are known for their very high quality training. We did this by means of the institutional platform of the university. So this was very useful to hold our courses, our conferences, and we also leveraged the different professors and professionals that the university offers. And we could adapt to what was necessary. at that moment. This was a challenge to us, a challenge to the university, and also for the students. But we managed to find the space to connect, to the availability to share the experiences. We had to share and talk about the problem as we had to. This course was very important, and it was also possible to take different virtual seminars working with different strategies for prevention in drug abuse and also dependency. We also had another virtual seminar on the general aspects of addictions and damage reduction in the consumption of psychoactive substances and other dependencies. We had between 200 and 300 people. That is a total of 600 people who participated in these virtual seminars. We had different conversations and dialogues. One of them was the one we entertained with the population of the Tecnológico of Antioquia. We also had an open lecture, Uniminuto, and we had a virtual conversation for the prevention of consumption among children, girls, and teenagers with the Directorate of Childhood, Adolescence, and Youth, directed to 125 municipalities of the department. And we also had a regional encounter on mental health and consumption of psychoactive substances in the east of Antioquia. All these experiences have been very important, and we listened to the experiences of many students and we realized that the challenge of being in front of a screen and not being face to face was actually not that much of an issue. And also we had an open space where people could express their concerns openly. And the fact of not being face to face sometimes could be a bit tricky. But in this virtual space, we actually saw it was possible to open this space for them to speak, to share, and we were able to do this. So it was the experience we had with the diploma course, and thank you very much for your attention. We're open if you have any questions. Thank you very much for your presentation. We have a perfect connection and we have a very beautiful experience with this diploma course on the training and on abilities. And I imagine that all these seminars were very enriching, which is something very important. And also it is important to see how these programs open a space for collaboration with other institutions and universities, both at the local and the national level. Now I would like to pass the floor to Dr. Natalia Galliano, who has a master in anthropology, and she has the floor now. Good morning, ladies and gentlemen. Thank you very much for giving us this space. We're very sorry. We're having really bad audio from the participant. We're going to wait for her to get closer to the microphone. Thank you. Maybe you hear me better this way. I would like to talk about what we have been doing in the area of research, how we have adapted the strategies. I would like to mention what has guided our work, what has allowed us to do this. So we have been working for a whole year on this, and this had allowed us to provide us theoretical ground to all the work we're carrying out. And this...
Doctora, perdón que la interrumpa. Los intérpretes me están diciendo que no pueden escuchar su audio y en realidad estamos teniendo problemas también en el piso para...
I'm really sorry. The interpreters are saying that we cannot hear your audio properly. So please, can you get closer to your microphone? And we're also experiencing some bad audio in the main room. Thank you very much.
¿Así me escuchan?
Is this better? Yeah, that's much better. Thank you.
Bueno, como les venía diciendo, uno de los elementos que nos permite flexibilizar.
So as I was saying, one of the elements that allows us to adapt tools in the framework of the pandemic is that we are in the process of the theoretical grounding of the school, because we are working on this introspective work. That is, we have to know where we're going, what we want to do from the very first moment of our constitution as a school. And from the beginning, we have this strategic planning in mind. It is important to work as a group, and this has allowed us to have or entertain some meetings. As the director said, we had some virtual ones, we had also some face-to-face ones, and when we met face-to-face, we started talking about very specific issues in order to reach agreements. Afterwards, this strategic planning, which took about 6 months, where it was very important in this period to find strategic partners. Just as the dialogue we had with you, we were also thinking what kind of research or pieces of research were strategic in order to work on them. And that's when we started working for 6 months on documentary research across these 3 axes, which is first damage reduction, then attention models, and third, restorative justice. So these were the main 3 axes of documentary research. And the fact of being documentary made it useful to have virtual reviews of the topics we had picked, and also to have an overview of what we had as scientific topics, and to identify ourselves as a school in this scientific sector. And we also had the possibility to talk about other actors, other strategic partners across different universities. We sent an invitation to all the people who were working with these topics in Colombia, specifically with the idea of gathering their inputs, and also knowing what they were working at that moment, what they were working on. We also had a call for proposals in order to create the lectures of the school. So we picked 21 articles of the ones they sent us, and we created this publication in order to create a piece of knowledge and also to strengthen the process we were going through and the process that we started hand in hand with the public servants of the municipalities in Antioquia. I think it is very relevant to underline that across these 125 municipalities in Antioquia some of them are close from here, the other ones are very remotely located, and the virtual format we have adopted has facilitated the fact that some people in remote areas, some public servants, can also participate and access first-hand information of the academia and the scientists in order for them to improve their prevention and attention tools.
También tenemos por otro lado que
Well,
hicimos
and
una
also
investigación, un diseño enfocado en la prevención, atención y reducción del daño.
we had
Allí
a
usamos
model for
en la
the
parte del
design
diagnóstico
focused on prevention,
participativo
attention, and
una
reduction of
metodología
damage.
que
We have
adaptamos,
a participatory
inclusive
methodology which we
pues la
adapt,
metodología CICAD para la realización de los diagnósticos locales, la
and we
adaptamos.
also
Ahí hubo una fase en
adapted
la
the
que
CICAD
hicimos
methodology
entrevistas,
for carrying out local
sesiones
diagnosis.
estructuradas, grupos focales, hicimos registro
This was part of a field
y ahí
research,
sí
and
tuvimos una fase
we
de
had also
presencialidad.
a
Esto,
phase
pues, básicamente
that included
porque es muy
face-to-face
importante
encounters.
estos diagnósticos estar
It was
ahí
very important to
poder
carry out these
probar
diagnoses
más allá
and
de
to
los
be there
discursos,
and
de
to
las narrativas de las
see
personas,
what is beyond the
cómo esta
narratives of people who
situación
are
en términos
involved,
de la vida
what the
cotidiana
actual
que hace la
situation
gente
is,
a la hora
what people
de
do,
usar su
how they
tiempo libre,
behave,
cómo lo
and
usa,
what
dónde
they
lo
do
usa,
in their
cuáles son los
free time,
espacios en los que
and
se
what are the
desarrolla su tiempo
spaces
libre,
where
la calidad
people
de los
spend their free
espacios.
time, the quality
Entonces,
of
todo
spaces.
esto iba a ser información
All of
importante en
this
el diagnóstico,
is
con lo
very
cual
important information
nos
in
adaptamos
the
también después
diagnosis,
de pandemia,
and this is
todo
why
lo que
we try to
implicaba
adapt to
las
the conditions of
bioseguridad,
the
lo
pandemic
tuvimos muy
in terms of
en
safety,
consideración y
and
no
of course we
obstante,
took this into account.
pues
However,
estuvimos
we
participando
were
directamente con la
participating
comunidad
directly
en
in
este
the
tipo de
communities
actividades.
in these types of
La
activities.
mayor parte de las actividades tuvo lugar
Most of
pues
the
como
activities
entrevistas
took
individuales con grupos
place
focales que
in the
toman
form of
en consideración
individual
todas estas medidas
interviews and
sanitarias
also
que les comento.
groups, focal groups, and different conversations.
De allí hay unos hallazgos que considero muy importantes.
From this point, we have some findings that I believe are interesting. And as part of this diagnosis, we can see that there were some consumption of SPA, which came down in terms of the people that we were able to interview. People said that this was good for their anxiety, and this is an interesting finding. However, at the same time, we need to say that some of these tools helped us to generate some measures to help parents, for example, because parents in many cases do not go to schools because they have no time. So now the virtual environment has allowed us to approach parents so that they can have a more active participation in their kids' education. And that is actually a good opportunity to talk about the consumption of certain substances. This research was done in a municipality that is located 8 hours from the Antioquia capital city. So in terms of approaching this type of far-off areas, virtual environments helped us reach them. Finally, the virtual environment has allowed for a greater versatility and to have more access to technical support, specifically for municipalities that are very far away in terms of access to education. And this type of spaces can be very, very important to gather data. So also the quality of data in terms of the rapport that we can generate with people in person contributes to the quality of the research. So this is my presentation. Thank you very much.
Thank you, Doctor, for this good presentation. I would like to add something from your presentation. So we can see now the introduction of innovation using, for example, communication technology that allow us to understand from your conclusions that as part of this pandemic and the challenges that it has brought to all of us, some opportunities have arisen in terms of how to communicate with
parents and children. For example, I just got an idea right now from what you said that everything that you do is very well planned. So that is a good emphasis on strategic planning that speaks well to the activity that you have been doing in this school. So in terms of innovation, not as such, but as an opportunity to actually provide better services. Thank you very much for your presentation and the prior two presentations. So it's a great pleasure to also introduce Mr. Rodrigo Goycolea Martinic from the Central University in Chile. The floor is yours, Mr. Goycolea. Thank you very much. Let me share my screen now. So hopefully you can see my screen. Can you see my screen? Can you confirm, please? Alfonso or anyone, can you confirm that you can see my screen? Yes, we can see your screen and we can hear you correctly. Okay, perfect. So thank you very much for the invitation to this session. Part of this work was presented last year, and now we will be talking about the lessons that we have learned so far. I will make an effort to speak a little slower for interpretation. I apologize for my usual speed when I speak. So this is the agenda that I have for my presentation. I will be talking about the team that has been involved in this research, a little bit of the context around the pandemic, some of the results of the measurements that we did, and some conclusions at the end. So the Central University in Chile has 3 different programs. So as of March 2020, in our country, we had to migrate to virtual classes, but synchronous, however. So everything related to the activity between students and their teachers were done by the Teams platform, and we were able to implement this technology in all of the different methods of teaching. So we have been doing, for example, this 2-year degree for technician since 2001. One has been going on since 2014, and a master's in intervention for drug dependency that started in 2000. There are 2 programs that are still that are work in progress, that we were not able to implement them, so they have been pushed for 2022. So this is basically an general overview of what the drug program from the Central University in Chile that is located in Santiago has. So as part of the team, we do have a support secretary since December 2018 and some coordinators that support with all of the administrative matters that has been absolutely critical in reconverting our materials to the virtual environment. So creating the virtual rooms to implement the Teams platform. I will talk that in a little bit. So we currently have 70 students in the technical technical degree. We have 28 in the diploma, 18 students this year in the master's. So this was very interesting because last year we had 6 students less than that. So it was really great to be able to do this. We had 6 students 2 years ago, and this year 18 in the master. So this was unexpectedly a good news. And we didn't know that this was going to help us get students specifically in the master's degree. So we're very pleased with that. Now, in terms of our teachers. We have 15 for the technical degree, 5 for the diploma, and 28 for the master's. So we had to work with all of these people. So that is why it is important to introduce who are the members of the team, who are the different stakeholders in this drug platform, acknowledging that this master's degree is the only one in the country, and this diploma with this specific characteristics is also the only one in Chile. So what happened in last year? So the pandemic happened, so there was a need to make a lot of changes in the programs for the 2020 and 2021 cycle. And there are certain lessons as well that have been learned from mistakes that were done. However, the information that we have currently for August 2021, we have the second semester, and we will come back to in-person classes. So we will now convert, let's say, go back to the previous model, and little by little, we will go back to in-person sessions. So this week, actually, we have been meeting to know how to make the corresponding changes with students, with speakers and professors in the university to design the correct program. What were the main changes that we implemented? Well, mainly the mandatory nature of or the fact that all teachers had to mandatorily use this new platform. So it was the Teams platform. All professors needed to get acquainted with the different features of this platform. It used to be a semi-mandatory channel, but now it became an absolute necessity to learn how to use these platforms in full capacity so that they can also work. The second part of the slide mentions that how teachers and students needed to learn how to use Microsoft Teams. So all of the people involved in the university have an account with Microsoft Teams, and the teachers actually have access to another platform to their teaching materials. So there was a big issue with trying to get the Microsoft Office license for the university. So now we have been able to implement that change, and that helped us a lot with the presentations with students and professors, specifically with how to share these classes online. The third point in this slide is related to the structural change of the classes, of lessons. That was a very interesting exercise to be done. Classes were done Saturday morning, synchronously with the professor, and during the week there were videos, so that was an asynchronous way of teaching. And finally, some consultancy and some tutorship for teachers and students, that is to say, how to help our professors and our students solve technical issues like forgetting their password or not knowing how to do certain things. We have been doing this for 1 year and still people need some help with that, so that is an important feature of the program. Now, some of the main results from our survey 2021. So we have data coming from 2019, 2020, and 2021. 40 people responded to this survey. We did not get to a high number that we were aiming for. Those are the results that we can share with you so far. So 40 surveys were answered. All of the professors were evaluated, were assessed. 55 of the participants are women, 25 men. Also, professors self-assess their performance, and more than half of the respondents mentioned that all professors have performed at the mid to high level. 15% only report a low level of performance. Now, in terms of the results related to the future of this profession, Most of the respondents are hopeful in terms of how this type of work will continue in terms of incorporating this type of platforms and how this has also helped with other areas, for example, telehealth and teleeducation and e-learning. All of that in terms of training of teachers has been quite useful. And in terms of the methodology of the classes, and more than 70% of students report to be happy with the methodology. Now, in terms of the latest results, we were very interested in the performance of professors because there is an overload of classes and of scheduling slots in their calendars. Most of students agree that the performance has been adequate. Now, class methodology that this allowed them to achieve the objectives of the class in this asynchronous virtual environments. Most of students are in agreement with this question. Now, in terms of whether you would recommend this professor to other students, more than 50% said yes. And how would you rate the general performance of those professors? 54% of students rate them in a favorable way. So some of the conclusions that we have drawn from the different methodologies is that, number one, we're still learning. We will continue to learn from our mistakes. The accompanying program has been quite successful for this year and a half. We have been able for students to actually graduate and to achieve their learning objectives. We continue to make mistakes, stated, but less so. And people are, as long as people continue to use these tools, they will be very it'll become easier to just correct any problems. Likewise, another conclusion is that we feel quite privileged in terms of being able to transition to the virtual environment. We know that of many other institutions that were not able to do this, so it's a great privilege to have been able to do this. And finally, we never thought that this type of programs could be taught in this way. So this was a big paradigm shift in our minds. Now let's talk about challenges for 2022, and these are my wrapping up comments. The diploma that was being done in person will not be taught anymore. So any Spanish speaking person, because we don't have this for English speakers, but any Spanish speaking people will be able to learn from this diploma virtually from now. So this is a great opportunity to tell you this. And there will be two postgraduate programs. One would be the general population drug prevention programs, and another one for drug-related treatments. And there are a couple of courses that will be also implemented in an asynchronous way 2 weeks from now that are related to health sciences and for this summer in Chile. Any questions you may have, please direct them to this email. I feel like I was on time, but hopefully I didn't go over my time too much. Thank you very much. Thank you very much, Rodrigo. All 4 panelists have stayed within your allotted time, which I really appreciate because I understand how difficult it might be to express all of your ideas in this reduced time frame. So thank you very much, Rodrigo, for this presentation. For those who don't know, Rodrigo was part of the first virtual ICUDDR sessions last year. And many of the conclusions that Rodrigo has actually talked about today are the continuation of the activities that were starting to be implemented last year only. As part of your conclusions, there is something that I can say here that is really interesting, which is the fact that we continue to make mistakes, but we will continue to correct them and we will continue to learn from them. So that is the basis of all of our work right here. And I hope that all of these conclusions and all the information that you have presented will be useful for our audience as well. Now, the floor is open for comments or questions. I currently don't see any comments or questions on the chat and the Q&A icon. However, I do have a couple of questions that I would like our panelists to speak to. First off, Dr. Galeano was talking about the fact that as part of their work in their school, they have been applying the CCAD methodology. So I would like perhaps for Dr. Galeano to elaborate on that, because I believe that this type of methodology has been rescued from the work that we do here, and you have been able to do it on your schools. So can you elaborate perhaps, Doctor, about this methodology and how successful it was in the implementation? Of course, thank you very much. First, we need to understand how this problem was being tackled by the local jurisdiction. So we assessed the different methodologies to see which one would be most appropriate for our context in Antioquia. And we finally concluded that the CCAD methodology was quite comprehensive and quite appropriate for our context. So we needed to see how to appropriate this type of methodologies in order to find a method to teach these programs in our two graduate programs. So that was part of the analysis that we did, and some of the different elements that we noticed that could be improved based on our needs. We did that, and then we made an assessment on the effort needed to make the different changes based on the recommendations that came out of the assessment and how long it would take to do them. Because this methodology is basically a quick assessment. So I can say that the methodology really made our work easier. And since it has been approved by CCAD, it's something that helped us trust the method, and we felt quite confident in implementing it with our communities. And we also implemented surveys so us to understand how the users felt with the method. This was very useful, and this allowed us to understand the local reality. This was very, very useful to promote new interventions. Thank you very much, Doctor, for these comments. There's a question for Rodrigo. So, Rodrigo, in the work that you do in the university, the assessment and the actual implementation of learning programs is the big challenge, right? So to evaluate learning and implementation of programs. So the methodologies of the pre-pandemic world, we all thought that those programs and those methodologies were well structured in no need of change. But when the pandemic came, we had to change completely our outlook. So we would like to know, what have you been able to implement in the university in Chile? Some of the things that is not very much spoken of is the different types of assessments. That is to say, what are the main challenges that we can see in the surveys to the students? But there's not a lot around the evaluation or assessment of students. So what are the challenges that you have had in terms of actually evaluating your students beyond the identifying the learning needs, which of course I understand it has been in itself quite a complicated thing to do. Thank you very much for that question. So yes, the evaluation strategies had to be modified from the point of view of the context where students are responding to those evaluations, because sometimes they are not in the correct environment to do this. Sometimes they're in houses, their kids, family, etc. These are not the best types of environments to be evaluated. So, for example, we implemented recorded tests. They could have also an extended time frame to answer, but once they go in, they have to answer a test in 1 hour and a half, which is more than enough time. So if a person had problems with their connection, they would tell us, we would open the test again. So the main issue here, the core principle was flexibility. And what we learned from 2020, because we made a lot of mistakes in 2020, now in 2021, we have learned that we need to be more flexible with the evaluations. And as part of this different changes, we needed to provide a extension in the time frame so that students can find the time that is best suited for their needs, so that they can find a good time for their internet connection, or that they can contact us so we can reopen the session for them, or to do as well some group assessments orally. And we try to find also different alternatives so that they can present their tests perhaps at some point where their internet connection was best, because on Saturday mornings it was quite hard to find a stable internet connection. So we made a lot of changes so that we did not add an additional layer of anxiety, of complication on top of the several uncertainties around students' lives. So we were aiming to make life less stressful around the assignments and the evaluations, on top of the actual situation that we were all facing in any case. So we were not going to say, okay, we are not going to test or evaluate our students. We had to do it. But since 2020, when we have been trying to implement different tools like Kahoot and Google Forms and other type of tools that we were able to test, allowed us to understand how to better evaluate our students and relieve this burden that students are already carrying from the pandemic. So that is part of what we have learned. That's what I could say to that. Thank you very much, Rodrigo. We still have 4 minutes. I don't have any more questions. I don't know if anyone from the panel would like to say something else or connect their message to the other presentations. I am opening the floor for final comments. Okay, Alfonso, so thank you very much for the opportunity to wrap up. I believe that the paradigm shift that had to take place was dramatic, was very, very big. We are not changing 100% to online activities, but now that we are transitioning back to in-person sessions, we have learned that some things are actually better suited for the virtual environment. So now, listening to my other colleagues, we have learned that teaching and learning can be effectively done in both ways, in person and virtually. So we just have to learn from everyone. Thank you very much, Alfonso. I would also like to take this opportunity to thank you, to thank ICUDDR for the invitation. Listening to the other conferences this day and the ones that are to follow tomorrow will be important. So something important to say is that we will continue to work with the recommendations that we have received in our teaching programs, especially in the restorative justice for children and teenagers. We will continue our research with clinical risks, and we will start new research programs. Some of them will be quantitative. We will carry out a survey and a diagnosis in terms of the consumption situation in the Antioquia department. And also, as Natalia mentioned, what we have done on the field, we have also decided to create a board as part of a direct recommendation of the governor to use the CCAD methodology. This comes from Yolanda Torres, Guillermo Castaño, and a recommendation from the governor, Luis Ronaldo Suarez. So we will be using the CCAD methodology to develop these programs. And something that I would like to add is that in terms of the diploma and the appropriation issues, we still have the idea that now that we are in this pandemic, that this will have a positive evolution, right? So we will continue to move towards a hybrid model. However, in the virtual side of things, we will try to incorporate more synchronous and asynchronous methodologies together. So the diploma that we will kickstart this year, which is for professors of public institutions, we will be using asynchronous methodologies combined with synchronous methodologies and in-person workshops. So we will continue to work on this. It was really great to listen from Rodrigo, the experiences in Chile. So thank you very much, Alfonso, for the invitation. Thank you for these final words, not only for your presentation, but for the whole panel. I believe that was a really nice wrap up of what the other panelists have mentioned. So thank you very much, Mr. Octavio Villa, Natalia Galliano, Ana Maria Rivera, Rodrigo Goycolea, and Fabio de Jesus. Thank you very much for your presentations, for sharing your experiences, and for using your time correctly. And also thank you to our interpreters, Carlos Arroyo and Enrique Perez, and the whole ICUDDR team that have been behind the scenes trying to coordinate this event. Thank you very much for all of your help, and I wish you all the best. This virtual ICUDDR meeting is just getting started, so please continue joining the different sessions for today and tomorrow, as well as the 2 master classes today afternoon. I invite you to participate, to join those sessions and any other panels that you find interesting. And please feel free to share all of your experiences in the different panels so that you can learn from the different institutions and countries. Thank you very much once again.